Good morning, good afternoon, and good evening, everyone, and welcome to today's live class here with me, Scott from Swoosh English, having a look today at OET Mock Speaking. Hope you're well. Thanks a lot for joining. First things first, as always, if you've been to these classes a few times before, the first thing I want to do is make sure that you can both hear me and that you can see me as well. So please, wherever you are watching, throw in a comment into the chat box. If you're watching on Facebook, you're watching on YouTube, wherever you're watching, please just let me know that you can hear me and that you can see me. Say hello. Say, how are you doing, Scott? Say, yes, I can hear you. Say, no, I can't hear you, etc., etc. But if you're answering, no, I can't hear you, that means that you most definitely can hear me. Doesn't matter. That's still a confirmation for me, guys. So throw in the comments, please. Once I've got a few people have said so, then I will know that we are good to go and we are rocking and are rolling. Thank you, Shoba, and thank you, George. That's all I need to know, and we are good to go today. So welcome to the session, everyone. I hope you're having a great week. Your OET preparation is going well. Wherever you are studying, you're feeling confident, you're making strides, you're making improvements, you're working towards your big goal of acing that OET exam the next time that you take it. So, as I said, my name's Scott. If you come to these sessions before, if you've been to these sessions before, then you will know me well. You will know us well at Swoosh English. I'm the academic director. I've been a teacher for many, many years now. I have plenty of experience and fun with teaching IELTS and OET and other exam preparation classes over my English teaching career so far. I'm now, of course, here to help you online with Swoosh English for your OET preparation. We've been an online English preparation academy for the OET exam now for many years, and we're looking forward to helping you guys out today. That's a bit about me. Now I'm looking to know a bit about you. So I've got a couple of questions for everyone. Let me know, of course, where you are from and what time it is as well. Let me know what time it is in the world, wherever you are, and also where you are from as well. I'm from Ireland, right? So I'm from Ireland. Let's see who is the closest to me, and let's see who is the furthest away from me. I'll test my own geographical knowledge today in this session. While these comments are coming through, I'm going to see who has joined us today. We have Marie, we have Swoosh, no, that's me. We have Annie, we have Shoba, we have George, we have Leno, we have Aram, we have Lucy, has joined us over here on the Swoosh English channel. We got a lot of people over on the OET channel. We have Honey, Shanti, K Mose, Bitta, Axamal, Kevin, Maya, Priya, Sini John, Manu, Angelo, Tinju, Sarab, Mustafa, Alumni, Suraksa, Chippo, Etina, Day, Arshia, and Iram and Mon as well. Welcome, guys, over on the YouTube channel. Let's see who's over here on the Facebook channel with OET. We have Shob, Jose, we have Jyoti, we have Leslie, we have Mohammed Yassin Saad, we have Ruth, we have Juliet, we have Doms, we have Ontabil, we have Gayathri. It's always a practice of my pronunciation, guys. Saraswati, I think so. Divine. We had Jipin, we have Amigbor as well. Great, a lot of people coming here today. Let's point out a few people and see where they're from. We have Benitha, we have Anne from the Philippines. We have K Barathi, 130, currently in India. We have Ruth is in Zimbabwe. We have MC Bruno has said so. Ikani, I think, is one that said Jackson in Ireland. Great, great, fantastic. A good number of people from all over the world today. A good number. We have Suraksha is currently living in the UK. Honey's living in India. Manu from Kerala in India. Dua from Sudan. Right, fantastic. Good, good, good. We have Dorothy from Zimbabwe. Beta from Kuwait. I'll pick a couple of more and then we'll get going. Dai from the Philippines. Priya is living in Saudi Arabia as well. Lovely, lovely. We have Chris from the Philippines. We have Dharan Kumar from India. We have Gia said, I'm from the Philippines, currently living in Saudi Arabia. Fantastic, guys. A nice international bunch today. I didn't get to call everyone's name out and tell you where you're from. Of course, I'm sorry, but you're more than welcome to today's session. So I guess we have someone living in Jackson. That's the closest thing to me. And also, I guess the Philippines currently, and everyone has said is the furthest away from me. Anyone here from Australia or New Zealand that will be even further away from me again? Let me know in the comments, guys. Fantastic. Thanks a lot for that. So let's get started with today's session. We're, of course, looking at our OET mock speaking class today. I'm excited to help you guys out with some mock speaking practice today, and it's going to be great to hear what you guys are going to say about your mock speaking. So let's get started with our mock speaking class. Okay, so guys, what are we going to be covering in today's class? Well, today, we're going to be learning and reviewing the scoring criteria for OET speaking. If you're brand new to OET, then it's a great way for you to learn that criteria. If you have been preparing for OET already, well, it's just good to review it and make sure that you've got a thorough understanding about what the criteria is. Very important. You're going to take part 2 or listen to some OET role plays today. Of course, there's a lot of people in the class today. I'm trying to get people one-on-one. So the people who do get a chance to speak today, well, of course, you're going to enjoy the speaking. But of course, those who don't get a chance to take part today, well, it's still important for you to see how the OET speaking exam will go. You can listen to the student, give your own feedback on the performance, and reflect upon that to see how well you would do in the role play if you were doing it as well. Okay, and then if we have some time at the very end, a brief Q&A on a few aspects of your OET preparation, today's class, etc., etc. So I'm excited to get started with the class. The first thing I'm going to mention to everyone is, of course, about the criteria. So the first question is a question in regards to the OET speaking criteria. As you probably know, there are 2 sets. If you don't know that, well, you know that now. There are 2 sets of scoring criteria. Who can tell me what are they? What are the sets of scoring criteria for OET speaking? Even better, again, if you could tell me what the criteria within the criteria are, you get extra points. Now, there's no prizes for extra points today, but just so you know, you're getting extra points from me, bonus points. I'll remember your name and I'll give you a big shout out if you can tell me what they are. Let me know, guys, in the comments, what are the OET speaking criteria? Please throw them into the chat box, please, while I'm waiting for them to come through. I'll just see who else has joined us today. Vivian, watching from Kingdom of Saudi Arabia. Layali, watching from Lebanon. Vinya, watching from India as well. Fantastic. Also, guys, let me know when you're taking the OET exam. Are you taking it very soon? Throw me into the comments, guys. When are you taking the OET exam? And Suman is watching from Nepal. It's currently 2 p.m. as well. Okay, both Leno and Shobha have said linguistic and clinical communication criteria. Someone said communicative criteria. That's okay too. But we're throwing it in. MC Bruno, linguistics and clinical, Anu, clinical criteria, Nenithia, linguistic and clinical, over on the Facebook page. Fantastic. Over in the YouTube channel, we have Asha. George has said linguistic and clinical criteria. Maya has said linguistic criteria as well. Okay, guys, you're pretty much on the right aspect. Here we go. We have both the linguistic criteria and the clinical communication criteria. It doesn't matter if you don't know exactly what they're called. What's the most important thing is that you know exactly what's being assessed for these 2 sets of criteria, which there are 4 sub-criteria for linguistic criteria and 5 sub-criteria for clinical communication criteria. Very nice. Let's have a look now and assess exactly what they are. What do you have to do for these aspects of the criteria? So let's look at linguistic criteria. As you can see, there are 4 sets of criteria for that. They include intelligibility, fluency, appropriateness of language, and resources of grammar and expression. But exactly what do they mean? Well, first of all, your intelligibility. That assesses your pronunciation, your intonation, and your accent. Let's look at those one by one. Pronunciation, your ability to pronounce the relative sounds in English very well, your vowels, your consonants, your blends, your diphthongs, etc., etc. Can you recreate the sounds according to both, I guess, standardized American English or British English? Intonation is your pitch. Do you speak flat like a robot the whole time? If you do so, please change that and vary your intonation according to how an English speaker would speak. For example, at the end of a question, the pitch would typically go up. At the end of a statement, it would typically go down, etc., etc. And then finally, your accent. Now, first thing I want to say is that everyone has an accent. I have an accent, you have an accent. Believe it or not, guys, I'm changing my accent a bit today. I'm doing what everyone should do in their OET speaking exam. Neutralize your accent a bit to make everything just a bit flatter and a bit easier to understand. So you don't have to try and speak like the Queen of England, for example. You don't have to, as long as you're minimizing your accent in case it's particularly heavy to make it more understandable. Native English speakers, even from Ireland, for example, Australia, etc., will even do that as well, depending on the situation. So just neutralize it a bit, but don't change your accent, so to say. Then we have fluency, which is the impact of the speed and smoothness of your speech on your listeners' understanding. People think that fluency is often about speaking as fast as possible. Fluency is not about speaking as fast as possible, because what happens when you speak very, very quickly? Well, you might get tripped up in your words, you might hesitate, you might make an error, which can then impact your grammar and your language as well. So fluency is all about maintaining a steady state of speech effortlessly with as little repetition, as little hesitation, and as few false starts as possible as well. So take your native language, think about the speed you speak in your native language, bring it down a bit, maintain that speech and that speed for your OET speaking, will be my top tip for fluency. Appropriateness of language, basically, do you sound suitably professional and is your tone great, obviously for a doctor or a nurse? You don't want to be too formal and stuffy, but also you don't want to speak too informally like you're speaking to your friend on the street as well. So keep it appropriately formal, but as I know, doctors and nurses, you guys and anyone else, pharmacists, etc., you guys know an appropriate tone to speak in English for the most part, especially for your job. And then finally, resources of grammar and your expression. So your grammar, are you using it accurately, are you using it appropriately, and your vocabulary, are you using it accurately and are you using it appropriately as well. That's the simpler criteria, the linguistic criteria. Let's look at the unique clinical communication criteria for OET. Before we get into that, Annie has said that she is taking the exam on May 29th. How do you feel about your exam on May 29th? Annie, let me know. Great. Okay. Clinical communication criteria. 5 sets of criteria for that. We have relationship building, understanding and incorporating, providing structure, information gathering, and information giving. Let's look at these bit by bit. So relationship building. The clinical communication criteria has been designed to reflect upon good standard practice with your clinical communication. Are you providing understanding? Are you checking for understanding? Are you showing empathy? Are you showing care outside of your good language skills as well to be an appropriate and effective clinical communicator? So, of course, it's very important for you to build a relationship with your patient. So that's the impact of your choice of opening to the conversation and demonstration of empathy and respect on your listener's comfort. For example, would you start your consultation with, "Take a seat, what's the problem?" No, believe it or not, some doctors and nurses might start like that. No, you also wouldn't say, "Hi, how are you? How have you been? What's the problem?" Something like that. Too informal. Think about a nice, suitable, formal opening to the conversation. Something like, "Hello, my name is Dr. So-and-so today, and I will be attending you. How are you?" "Okay, great. Thanks for that. How can I help you today?" Something suitably formal, but also friendly and showing empathy. Likewise, you want to demonstrate empathy throughout the conversation, especially if the patient is giving you some sad or difficult information, okay? "Oh, I understand how you must be feeling. I'm very, very sorry to hear that, but let me reassure you that," etc., etc. There are many phrases that you should learn, of course, throughout your OET preparation to demonstrate empathy. We're going to put some of those into practice today. Likewise, understanding and incorporating. So understanding, the first part of that is making sure that you once again, respect that empathy. You're making your listener feel comfortable. You're showing that you care, but also incorporating, which means involving the patient. Sometimes doctors and nurses take a tendency to speak too much, dominate the conversation. Yes, you should be speaking the majority of the time throughout this consultation, but you need to involve the patient as well. It is a dialogue after all. So ask as many open questions as you can about the symptoms, about how they feel. Expand the conversation. Find ways to get them involved in it. Because after all, it is communication, and communication is two-way. Providing structure. So you need to organize the information in your case notes and provide new topics for discussion and your listeners' understanding. Once again, asking questions about not every point, but as many points in the card as possible to help your patient understand and be involved in the conversation, but also to organize your information logically from beginning to end. For example, start off with an opening, take the initial remarks, start asking questions about what the main issue is. They answer the questions, ask more questions, etc., etc. Start to diagnose, take more queries, answer the queries, check for understanding, come as a resolution at the very, very end. Of course, give a brief summary if need be, give your next steps, say goodbye. A rough idea about how to structure your role play, but it needs to be structured, it needs to flow from beginning to end. Next two, of course, are information gathering and information giving. So information gathering is the impact of the type of questions you ask and how you listen to the responses on your listeners' understanding. So you should be asking lots of open questions about the important parts on the role play card. But as the criteria also said, finding new topics for discussion as well. Likewise, you need to ensure that you're listening to the patient. So engage in active listening. Don't just sit in silence when the patient's going on about their diagnosis, about their symptoms. Engage in active listening. Say phrases such as, okay, right, oh, I'm sorry to hear that. I see, I understand. Active listening to show that you care, and also respond appropriately as well. Don't respond to something inappropriately. Yeah, you actually show that you're listening as well, but make sure you're responding with the next phrase of the conversation in the conversation too. So ask lots of questions. Think about how you can turn it into that, and make sure you're involving the patient as well. And then finally, information giving. Likewise, you have to gather the information, you have to give it back as the clinical professional here. So how do you provide this information and check information is being understood in your listeners' comfort and understanding? So while information gathering focuses more so on your open questions, information giving, of course, is giving your clinical opinion, also answering closed questions to ensure a patient understands what you have said. It can be quite tricky. It can be quite difficult for the patient to understand all that important information you're giving. So ask confirmation questions, closed questions quite often. How is that for you? How do you feel about this? Is this okay for you? Etc. etc. They will say yes, or yep, that's great, or no, can you explain a bit more? Depending on the situation. But you want to check that they've understood you with a lot of dense information that you are given. That's really, really important. There's a brief breakdown in the two sets of criteria, linguistic and clinical communication criteria, as well as the sub-criteria inside. So of course, in today's class, we've only briefly covered what you'll be scored on. It is, of course, very, very important that you are learning this criteria, you're practicing this criteria with various practice activities, examples, and getting feedback in your OET preparation to ensure that you're going to ace all of this criteria, get your high score, and get your B on the day of the exam. But yep, we're just doing a basic overview of today as we get into the speaking practice today. Okay, guys. So this is what we're going to do today. Soon, we're going to involve ourselves in some speaking practice. But in the meantime, we have some assessment questions. These questions are going to assess how well you have fulfilled the speaking criteria on a rough basis in order to give some feedback. So there are 5 questions for linguistic criteria and 4 questions for the clinical communication criteria. I'm going to use some of these questions today to see how well you did in your speaking practice. But of course, I want everyone else here to take a note of these questions, either by taking a screenshot, writing them down, or taking a photograph on your phone. You're going to use these questions today to assess each other in this mock speaking class. Likewise, you can take these questions away from the class today and use them in your own speaking practice that you're doing, maybe in your classes or with your friends that you're doing, whatever practice you're doing. Here are some assessment questions to see how well you have fulfilled the speaking criteria. So I'm going to enlarge the screen, guys, full screen. I want everyone now to take a photograph of these questions. When you have done so, please type in done or yes or something to indicate that has happened in the chat box that you're watching this class on. Once a good number of people have done that, we can then move on to our OET mock speaking practice today. So everyone, please take a photograph or a screenshot or write them down. And once that's done, please say yes. Is this okay for you? I'm checking your understanding there with the question. Very cheesy, I know. Anyway, I'm going to be quiet for a second while everyone is taking those photographs, and then we'll see where it goes. Actually, I'm going to see how people are doing today. Thank you very much. A good number of people have said yes already. Selva, you are so nice. Selva has said, I'm her favorite instructor. That is so nice. Selva, you are my favorite student today so far. Let's see if anyone else can improve that comment. That is so nice. Juliet's taking the OET exam on May 29th. Wish you the best of luck with your preparation, Juliet. Darang Kumar is also taking an exam on May 29th as well. Fantastic, fantastic. Hope everyone's doing very well with their criteria. Maya is doing the exam on June the 12th, Christine on June the 12th, Anusha on May the 29th. Wow, so some people are doing the exam very, 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 very soon. Okay, guys, thank you very much. A lot of people have said done with this. So let's now get stuck into the next part of the class. It's going to be the OET speaking part of the class. So I hope to get 2 role plays done today, one for a doctor and one for a nurse. I would like, of course, to take other professions on board sometimes in class, in particular pharmacy. So, of course, if any pharmacists are in here today, please raise your hand and let me know, of course, if you are in here. And I would love to, if the case is high enough, prepare some pharmacy role-playing cards for future OET mock speaking classes too, to get you guys involved. Because I know there's a good number of pharmacists here today with the GPC registration in the UK going ahead. Fabi's taking the exam on May 29th, and Sherry Rose is taking the exam on May the 9th. Sherry Rose, 2 days' time. I don't know why I'm acting shocked. I'm sure you're going to ace this exam. Sherry Rose is one of our own students, and she's very, 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 very hardworking. I'm pretty certain that Sherry Rose will know what she's doing when it comes to this exam. But Sherry Rose, let me know how you're feeling about your OET exam. The fact that you're taking it in 2 days' time, absolutely amazing. Anyway, guys, let's get into the next part of the class. I'm going to show you the first role play card. What everyone's going to do today is you are going to prepare for this role play as if you are doing it yourselves. As you know, or you should know, you have 3 minutes to prepare for the role play, and then you have 5 minutes to speak. I don't know why the screen is like this. Let me just put the screen up to full screen so you can all see me again. So you're going to see the role play card for 3 minutes. Okay. When that happens, you're going to see a link in the chat box. That link will be for you to come into our streaming software, and you will be able to then join me for some OET speaking practice today. The first one will be for doctors, so I can ask that only doctors can come into the speaking class, at least initially. Nurses will have a chance later on today. If you are going to come into the studio with me and engage in some speaking practice, then I will ask if you can please turn on your camera if possible. If not, that's fine, as long as you've got a good internet connection, a quiet background, and a suitable working microphone so I can hear you nice and clearly. Unfortunately, if there are too many problems with that, I may not be able to continue with your role play today, as it needs to flow quite smoothly for the class as it goes along. Okay, guys, let's move on then to our first bit of speaking practice. Here's the first role play card. It is for a doctor. So guys, I'm going to start the timer for 3 minutes on my phone. Doctors and nurses, you can both prepare, but only doctors to come into the session when the link goes into the comments. Good luck, everyone. Prepare for 3 minutes, and then I'll take someone to do some speaking practice with me. Your timer starts now. 3 minutes, guys. Okay, guys, and that's the 3 minutes up. Could be the shortest or the longest 3 minutes of your lives. I'm not really sure, but hey, it's not a lot of time, right? Okay, well, that's the 3 minutes. Let's now get involved with our first role play practice today. So I'm going to allow Hazel to join me today. Let's see if you can turn on your camera and turn on. Oh, Hazel seems to have left the room. Oh dear, let's try someone else. I'm going to try Annie to come in and join me in the stream. Hello, Annie, can you hear me?
Yes, Scott. Hi, how are you?
I'm very well, thanks. And thank you very much for joining me today. Can you tell me a bit about yourself?
My name is Annie Varghese. I'm from Saudi Arabia. Actually, I'm currently working in Saudi Arabia as a nurse. I'm not a doctor, actually.
As a nurse, well, I'm going to ask if you can maybe join the studio again later because I want to give a doctor a chance to do a doctor role play card if that's okay.
Okay, sure. Thank you.
Thank you
I'll
very
be
much.
back.
But yeah, please join again for the nursing role play card for a chance to do some speaking. Okay. Thank you.
Sure, thank you. Yeah.
Thank you. Okay. Well, then we have Dev. Hello, Dev. Can you hear me? Can you see me? Oh dear, we've actually had everyone drop out of the studio so far. Okay, I'm going to allow anyone else who wants to come and join me for some role play practice today. Please come in and join me. We've had a couple of people come in, but unfortunately they've dropped out or they weren't nurses or they weren't doctors. So yep, I'm going to paste the link in one more time, guys. If no one's here to join me, then I can't do any speaking practice today. So please come in, guys. Join me in the link. I'm pasting it back in one more time. So come on in, join me, guys, if you are a doctor, and we'll do some mock speaking practice, please. Okay, I'll just wait for a few more people to come in, but make sure you are a doctor only. While I'm waiting for a few people to come in, I'm just going to see if anyone else has any questions or any queries about when their OET exam is while I wait for someone to come in and join me in the studio today. Sherry Rose has said, I have been practicing every day in preparation for the exam. And that's really important, Sherry Rose. To anyone else who's doing this session today, it's really important that you do practice every day. You get the support, the tools, and the feedback to do so. And you put yourself in the best position today, Sherry Rose, to pass your exam on Sunday. And I think everyone else is going to agree on me with that, with Sherry Rose and everyone else who's doing the exam very soon. The best of luck. Okay, so we have Dr. Midhat has joined us. Hello, Dr. Midhat.
Hello. Hello, Scott. Can you hear me?
I can hear you fine. So I'm going to assume that you are a doctor because it says Dr. Midhat, right?
Yes. That's right.
Fantastic. Fantastic. So welcome to the session today. Tell me a bit about yourself.
Hello, Scott. Can you hear me? Great.
So you're very well today. Very good. So where are you from and when are you taking your OET exam? Fantastic. So welcome to the session today. Tell me a bit about yourself.
Okay. I am. My name is Dr. Midhat. Just a little bit nervous.
That's okay. I want you to breathe. Take it easy today. It's all for fun. Be as relaxed as you can. We're all here supporting you today. I'm here to support you today. So just try and enjoy it as much as possible, okay? Relax. It's all going to be great.
Okay. So right now I'm having this. I don't know if it's a technical issue or what, but my the sound is duplicating somehow. I don't know why it's happening. Maybe I should close up a window or something.
That usually is the case. You might have the class streaming on two windows, and that's probably
Yes. What should I do?
happen. Yeah, so if you can just check and see if you have the stream playing in two windows, if it is playing on a second
Okay,
window.
I'll.
Yeah, sure. Take your time. No problem. I can wait for you to start.
Yes. What should I do?
Yeah, so if you could just check and see if you have the stream playing in two windows, if it is playing on a second.
Okay, Okay. I think it's okay. It's working fine now.
Great. I sometimes have
All
that.
right.
I sometimes have that problem too because I have three windows open on my computer, and I sometimes have sound playing in three windows, and it's very disorientating, right? It's like, oh my
Very.
goodness, I can hear my voice coming
Yeah.
from three places. It's crazy.
Absolutely.
Yeah, so
That's right.
please,
Okay.
as we were saying, tell me a bit about yourself, please.
Oh yes. So right. So my name is Dr. Midhat, and
Mhm.
I have I've just got done with my internship or house job just last year,
Mhm.
and since then, since I've been studying for OET, I gave my OET on the 7th of November. I lost by a point in the reading module, and now I'm reappearing again for OET medicine on the 29th of May.
Mhm. Mhm.
And which is why I'm here for the class, speaking class. I've lost my confidence again, so here I am, Scott, ready to brush up on my speaking skills again.
Awesome.
And I'm basically doing sitting OET for pleb exams,
Mhm.
and yeah, that's mostly it about me.
Well, hope this goes well for you today. You've done it before. You know exactly what you have to do,
Yeah,
and
yeah.
I'm looking forward here to helping you brush up on your skills for your next exam day in what 3 weeks' time, approximately. So
Yes,
great.
yes, yes.
So I want you to, if you've done it in front of the examiner, it should be easy doing it in front of me. It should be really, really, really easy, right?
Yeah, yeah, I'm hoping so. Yeah, I hope it goes well.
It will go well as it can.
Okay,
Okay,
thank
Dr.
you.
Midha, I wish you the best of luck. Everyone else does here too. I'm going to start the timer. Begin speaking for the OET role play today whenever you feel ready. Okay.
Okay, where am I going to see the speaking roll card?
That's
Do
a
I
very,
open the
very
window
good
again?
question. Thanks for bringing that to my attention. Can you see it now?
Okay,
Okay.
I can see it. Yep, yep, I can see
Thanks
it
for
now.
reminding me.
Thank you. Let me just is the timer started?
The timer starts whenever you start speaking.
Oh, I mean the preparation time. The
Oh,
timer
yes.
for preparation.
Yes, the preparation time has started. Did you have time to
Okay,
prepare?
okay, thank you. Okay, okay, thank you.
Oh, sorry, Dr. Midha, have you had time to prepare? Because the preparation time was, we don't.
Yeah, it was already given. Sorry, I'll just start now.
Okay,
I'll
okay, great.
start now. Okay,
Thank you.
all right, I'm starting now. Hello. Thank you for coming in. My name is Dr. Mithat, and I am the treating doctor for today. May I know your name and age, please?
Hi, doctor. I'm Scott, and I'm 32 years old.
Okay, Scott. Thank you for that. How can I help you today?
Well, I've been really, really, really anxious and really scared the last couple of days. I had the flu recently, and it doesn't really normally happen to me, but as you can see, I'm feeling it right now. I've been really
Mhm.
short of breath, and I feel like I'm very anxious. I don't know what's going on, but I've got a really, I feel really bad. I can't
Mhm.
breathe at the minute. I don't know what's going on.
Okay. Right, Scott. I am sorry you feel that. You certainly seem anxious. Um, it looks like, from what you've told me, it looks like you may be suffering from asthma. Have you heard about asthma before?
Yeah, I mean, that's what I thought it was too, myself, doctor. I think that's why I was coming in today because I thought I had an attack. I felt like I was going to die. I really couldn't breathe. I thought this is it. So this is what
Mm-hmm.
I think it is, and I'm happy to hear that you think it might be that too. Uh,
Mm-hmm.
um,
Right.
yeah.
Okay. Okay. Thanks for telling me about that.
Mhm.
Right. So okay, so has this, if you don't mind, I'd like to ask you a few more questions if it's okay.
Yeah, please, please.
Okay, okay. Have you had such an attack before? Um,
No, it's only really come on recently when I had this flu, so it's really new to me, and that's why it's so scary.
I know. Okay, okay. That's understandable. That's
Mhm.
certainly, I can only imagine what you must be going through. Well,
Mhm.
there are a few things that I'd like to talk about first. Let's move on
Yeah.
to the causes. What may be causing your asthma?
Yeah,
Okay,
I actually want to know that as well. Yeah. Mm.
good. Okay, okay. That's good. All right. So the causes of asthma, what really is causing it? What could be causing it? Perhaps maybe it could be environmental factors,
Mhm.
or something. Maybe it could be dust. Um, you know, dust because of maybe where you're living.
Yeah.
Something as simple as curtains, carpets, or maybe pets in the house that could cause
Yeah.
asthma. That could be precipitating factors. Are you following me?
Yeah, I do. Yeah, I do think I got
Yeah,
quite a dusty house, and we do have a dog at the house too. So,
yeah,
who knows? I mean, that's good to know that these can be removed.
yeah,
So,
yeah.
doctor, how can it be treated? That's what I'm looking to know. How can this be treated?
Okay. I'm really glad that you asked that question. Let's move on to your treatment now.
Thank you.
So this is so the treatment. Okay, we have medicine available for attack for the symptoms that you've just described to me. Very effective. It's called Ventolin or salbutamol. Have you heard about these medications before?
Oh, well, I've heard of Ventolin, and I've heard
Mm-hmm.
from
All right.
others who have used it that it can become
Mm-hmm.
very addictive. Is that right?
Yeah, it's very effective. It's definitely proven to be effective. Patients have benefited from this medicine, and yeah, they report that that it's proven very effective for them. So yeah, so that is one treatment that I'd like to um, prescribe in a short, a little bit later in our consultation. Now, now I'd like to know what you think about the medication. Are you okay with using it?
Yes, I think I would be okay with using it. I have heard that
Okay.
people can get addicted to Ventolin, though. But
Uh,
is that the case?
no, that's a good question.
Mhm.
But I'm going to reassure you at this point that Ventolin is absolutely safe, and it's benefited a lot of people. People are living their lives more comfortably using this medicine, and really, and there isn't really anything to you for you to worry about. And also, if you've got any other questions regarding your symptoms, please do ask. And
Okay.
um,
I guess I have one question, doctor. As you know, I'm quite anxious about this. I mean, I felt awful today, and I did feel like I was
mhm.
dying. I wonder if that's the case. Can people die from asthma attacks?
Okay, that's really good. That's the completely valid question. Of course, you would be worried about something like this happening again, and it's absolutely, uh, can make one person anxious for future. So that's good that you asked me. So yeah, I'd like to address this problem. Um, I just like to point out and sort of reassure you that once you get into the habit or once you start using this medicine,
Hmm.
the good part is that the your airways are going to feel a lot more, you could say, open and rather
Hmm.
your asthma will be more controlled, and the prognosis for asthma patients is really good, and it
Okay.
isn't something that you should worry about. If there's anything that's worrying you, you know where to go. You can contact me if you've got any other questions, but really you shouldn't be stressing about it. As soon as we start you on this medicine, you'll be good to go.
Okay.
Okay, so do you have any other questions?
No, I think you've reassured me today, doctor. I think it does seem quite manageable. I'll look
Okay,
into the dust sources in my house. I'll check the
okay, that's
medication,
good.
and I guess I'll just try and remain calm, right?
Great. Yeah. That's mostly it. And
Mhm.
just if there's anything else that you'd like to know, let me know. Do not hesitate to ask me about anything. And thank you for coming in. And I hope you, I hope you feel better today. So
Thank you very
thank you
much,
for coming
doctor.
in.
Thank you. I appreciate your time. Bye bye.
Bye.
Okay,
Bye.
and that's the role play finished, Dr. Midhat. So,
Yeah.
first and foremost, well done. Thanks a lot for coming on today and doing that role play in front
Okay.
of a large audience today. The
Thank
scary
you.
bits out of the way. So, how did it go for you, the role play today?
Uh, so I think it was okay. I think I made a lot of mistakes. Maybe the fluency, or maybe I was finding it a little bit difficult to form sentences. I think that's an area where I need to, uh, improve. So I think
Hmm.
that's mostly just, and I think I did okay, maybe overall average, I guess.
Yeah, average. Okay. So, I noticed when I ask people, how did you do? The first thing they always say is, oh, I didn't do this well. I wasn't great at this, blah, blah, blah. there anything you think you did do well? Let's think about the positives. So anything you think you're quite
Yes.
strong at?
Of course. Okay. So, sorry, what was your question?
I asked, what do you think you were good at today? Anything
Okay.
you're
Sorry.
strong at when it comes to your speaking and your OET role plays?
So, I think I led the conversation fine. The sequence. I was trying to stick to the sequence and to basically, what they call signposting. So let's move on to that. Let's move on to that. And then maybe I also took care of the. I think I took care of the empathy side where I asked a patient again and again if they were okay with it, or were they following me, whatever I had told them so far. And the third thing that I think information gathering, I think I gathered the information okay as well. I just asked a few questions, but maybe that was done fine.
Sure.
Empathy was shown. I think these were some areas, and I think I introduced well. Introduction is the most important.
I agree.
Here.
I do agree with that. Okay, good.
That's
so
it.
good.
Okay.
You've got a good awareness of your strengths and weaknesses, which is great. Let's have a look quickly about my rough breakdown in terms of
please.
this criteria. So let's look at them one by one. Did you speak clearly and was easy to understand? Yes, your pronunciation overall is very good. You were mostly also easy to understand as well, which is very, very important. There was no real things I was saying. I'm not sure what she's saying at all. So yeah, scored pretty well for that. Did you vary your pronunciation, intonation relevantly? Yes. You've got a great intonation pattern, by the way, and your pronunciation was mostly accurate. So well done with that. Did you speak fluently and smoothly with few hesitations and false starts? For the most part. Now, the reason why your fluency maybe broke down a bit with some hesitation, not because you had difficulty with being fluent, but because you were nervous. That was the reason. I do think your nerves had a lot to do with that today. And so just try and control your nerves as best you can. Hopefully in the real OET exam, you will be less nervous. I know your fluency will improve. I just know that for a fact. But I don't think there are any language issues with your fluency from what I could see.
Great.
Did you use appropriate language and tone? Yep, suitable language and tone for a doctor. Well done. And did you use the relevant and correct vocabulary and grammatical structures? I didn't take note of any real issues with your grammar and vocabulary. There might have been some small minor errors and slips, but no, nothing that I could really know of. So well done for the linguistic criteria. Fantastic. So clinical communication criteria. Did you speak in a way that offered empathy and support? Your empathy was apparent throughout the entire conversation. You were showing that you cared, you were saying that you were sorry to me, and you were showing that you were trying to support me very well too. So you did pretty well for that.
Great.
Did you listen to the patient and respond effectively and appropriately? For the most part. One thing you could have done is engage in a bit more active listening. So whenever I was speaking, there was a bit of silence. You could say, okay, right. I see. So engage in some active listening. There was one point, though, where you misunderstood what I said as well. So when I said, at least initially, I think you're thinking you know what it is. But when I talked about the medication, I said addictive. And you said, oh, yes, it is very effective.
Oh, my God.
So it's a small error with understanding the point I was making. So that might have taken away from your listening and your ability to respond appropriately. So be very, very careful. Very similar sounding words, addictive, effective. Could have been my Irish accent. Could have been that. I understand. But anyway, just be really careful about that. Was the delivery of the information structured appropriately? I think you flowed through it quite well. And as you said, I did take a note of good signposting words. Let's move on. Let's now consider. So well done for signposting the conversation. Very, very good. And overall, was the patient satisfied with your delivery of information? Yeah, I would be. You showed that you cared. You gave me a good reason why I might have asthma. You suggested the treatment for me, and you reassured me as well as you can. Okay. A couple of small things I also want to address with the role play today. I think you asked maybe 2 closed questions at one point. Maybe there could have been a couple of more closed questions just to confirm the use of the medication and maybe what the next steps are going to be as well. So I wasn't sure, was I going to be getting this medication? How was I going to get the medication? And what was to happen next? But I do think you began the role play well and you ended it suitably well too. So that'd be one thing to take consideration. One big thing I want to consider today, and of course, I think your nerves may have played a role in that as well, was your time management. The role play was about
Okay.
6 minutes and 50 seconds. So it was a bit on the long side. So as
Yeah.
you know from your experience with doing role plays, you don't have a lot of time. You have time to keep your points concise and measured. And I do think that you were a bit nervous, maybe overthinking it a bit, and maybe trying to staying on a certain point a bit too long. So just be very, very careful with your time management. Move from point to point as efficiently as you can. That'll be my
Yeah.
takeaways today for that.
Okay.
How is that for
Right.
you?
Oh, this was so helpful. Thank you, Scott. I am absolutely so happy that I got to got to do this with you, and I think it's helped me tremendously. I really wanted an opinion, sort of like a view and opinion from someone who's qualified and who's especially a premium OET preparation provider. So I'm really happy that I got to do this, and thank you for the opportunity.
Sure, you are
Yeah.
very, very welcome. So just take a note of those points. Try and stay as calm as you day when you do your OET exam as well.
Okay.
A lot of things going
Yeah.
very,
Yeah.
very well for you, so you should be happy. But just focus in those small points just to make sure that you do as well
Okay,
on the
that's good.
day of the exam. So, Dr. Midhat, thank you so much for joining me today.
Okay.
Best of luck with your exam. Enjoy the rest
Thank
of
you,
the class.
Scott.
You're very welcome. Thank you very much.
Okay. Thank you.
Thank you.
Okay. Thank you. Good.
Okay, guys, and that's our first role play done today. Dr. Midhat, I think she did pretty well overall with her role play. Of course, I'm welcome to looking at some of your feedback today that you might have for Dr. Midhat. Throw your comments into the chat box. Give your assessment about how it went today as well. Be very, very happy to hear how you thought that she got on overall. Okay, guys. Anyway. So I just want to remind everyone that we at Swoosh English, of course, are a premium preparation provider for the OET exam. We've helped many, many students pass their OET exams before. And we want to emphasize the importance of getting support, feedback, high quality materials, and a teacher to help you through the process. If you're yet to start your OET preparation, best thing is that we at Swoosh English are now currently giving away some free resources to get you started on your OET preparation, our free OET masterclasses. You can sign up today. It's a completely free resource. You get access to 4 videos on tips, tricks, methods, strategies, and what you have to do to pass your OET exam the first time for all 4 subsections, and a free writing resource as well. I will be in the videos presenting them. So if you like me, you get a bit more of me with those sessions. If you don't like me, well, then too bad. You have to put up with me anyway, right? So sign up today, guys. The link is in the chat box for our free OET masterclass. I love to have you in those sessions. Okay, likewise, guys, before we begin our next role play, let me know how you think the class is going so far today. We are going to do one more role play today, this time with a nurse. If you're enjoying the session today, let me know in the comments in the chat box. Give me a like if you're loving the session. If you're not loving the session, then don't do anything not so nice for me, please. But I just want to know feedback. Hope you're enjoying the session today. Hope you're getting a lot out of that altogether so far. Likewise, you can see the banner at the bottom of the screen after today's session. If you have any queries about today's session, and of course about us at Swoosh English, the email address at the very bottom, inquiries@swooshenglish.com, and you can check out our website at www.swooshenglish.com as well. That would be awesome if you came and joined us and checked us out. Okay, guys, let's get into role play number 2. This one, of course, is for a nurse. Here is the role play card, guys. Like last time, 3 minutes to prepare. Once the preparation time is up, I'll invite nurses to come and join me for the role play today. The link will go into the comment feeds on Facebook and YouTube. If you are a nurse and you want to join us today, come on over. I would love to have you in the session. 3 minutes, guys. Preparation begins now. Okay, guys, and that is the 3 minutes of preparation time up. We got about 5 or so minutes left in this class, probably a bit longer than that by the time we get this next student in and doing a bit of role play practice today. So he's waiting very patiently in the wings. I am going to allow my friend Victor to join the session today. Hello, Victor Hugo.
Hello, good afternoon.
Good afternoon to you.
It's 4 p.m. here in the Philippines.
4 p.m. in the Philippines. It's currently just before 10 a.m. here in Ireland. Philippines only 6 hours ahead. I always thought it was longer. Must be daylight saving times, right? So welcome, Victor. Victor, sorry about that. Welcome to the session today. How are you? And tell me a bit about yourself.
I just got out from my shift today, so a bit tired, but I can manage. I've been working as a nurse for almost 4 years in my current institution, and yeah, that's mostly it.
Fantastic. And how are you feeling about your OET preparation? Do you know when you're taking your OET exam?
Oh, okay. I'm still on my review process. I don't have time. I still don't have schedule for my OET. I'm still planning to apply for a schedule. Maybe next month or this last week of May.
And make sure you do, my friend. Make sure you do apply. You do study effectively for your OET exam, because I want to make sure you do pass it the first time and not the fourth time. Some people do. So really, really important. I'm happy to hear that. Anyway, are you ready for some OET speaking practice today?
Okay. I don't know. It's my very first time to have an one-on-one class interview.
Well,
with a foreigner instructor.
Well, you're very welcome. Thanks a lot for coming, and enjoy the process today. Relax, just go through it.
Oh
make
my
the most of it. Okay, you're going to be great. Okay, you will feel a bit nervous.
Okay.
It is natural, but yeah, just try and enjoy it as well as you can. So you'll have 5 minutes to do this role play. The role play card, as you can see now, is on the screen here. I'll start the timer now for 5 minutes, and we'll just go through it as naturally as you can. Okay.
Okay. Can I? Y- Did you give me a time to review, or can I start now? My God.
Yep. The time to review was before you came into the session.
Okay.
So we're going to go for it now. Okay. Whenever you feel ready.
Okay. Good afternoon. Sir. May I know your? Good afternoon. I'm Victor Hugo, your nurse for today. May I know your name, please?
Hi, nurse. My name's Scott.
Okay, Scott. Although you're stable, your vital signs are stable, but in your road accident, you have lost blood, and that needs a blood transfusion. Uh, it seems that uh, how are you feeling today?
Well, not great, to be honest, nurse. As you know, I had an injury recently. You probably see from my notes, and I lost, a good bit of blood, and I've been told I need a transfusion. I'm pretty worried about this procedure. It sounds pretty scary to me. I don't know what's going to happen. And I've heard about the possibility of receiving infected blood, which really, really worries me. So I'm not feeling very good about it, to be honest.
Okay, thank you for sharing your concerns with me, and it must be really hard for you. But in this hospital, we can assure you that we are practicing safety precaution for not getting you the blood transfusion cross contamination. We make sure the bloods are screened properly, the donors are screened properly, and uh, yeah. How do you feel about that?
Well, I've just heard a lot about how patients have contracted HIV through transfusions, and that's what I'm really worried about. I just want to make sure, of course, that this hospital is going to do the exact same thing and making it and reassuring me that that's not going to happen, because that would be absolutely awful if I were to get that, as it has happened
Oh,
before. Mm-hmm.
oh, I'm sorry to hear that. But
Mm-hmm.
uh, I can assure you that we practice here the single use of needles, and we also we always use the new needles, the new blood set for transfusion, and us nurses will closely monitor you for any blood transfusion reaction on the process on the process of blood transfusion. Yes, and mm, how do you feel about that?
Well, it's good to know. I just want to know, I suppose, about what the procedure involves and if there's any risks involved with that too. Can you tell me a bit more about that, please, nurse?
Okay. Since you uh, since you lost blood, and although your vital signs are stable, in order you to recover fully, the blood that has been lost should be replaced. So uh, on the coming days, you'll be feeling better, and
That's
blood transfusion will help you to recover. Yes. So that would that be all for you?
okay. That's good to know. How do you know that that blood donors don't have infected blood? What's the hospital's procedure to make sure that doesn't happen?
Uh, they they cross match the blood between the donors and the patients. So if
Mhm.
they match, and it's good for transfusion. Yes.
Okay, well, that's good to hear. Do I need to have this transfusion, nurse? Is it essential? Can I recover without it? I mean, is that a possibility?
With with the blood that lost in your system, uh, the blood transfusion is really needed for you to fully recover. And then the doctors might give you an other um, vitamins to intake, to supplement your uh, hemoglobin in your blood. Okay.
Okay, okay. So you're saying it is important.
Yes.
Right. Okay. Well, thank you very much, nurse. I thank you for reassuring me about those procedures, about the chance of HIV being small, and also that I need to have it. So yeah, let's go ahead with the transfusion. Thank you.
Okay. Thank you for your consent. It is our pleasure to serve you. Okay. That would be all for you, sir. Is
Thank
there
you very much.
anything that? Uh, okay. You're welcome.
Thank you very much, Victor. Thank you very much. Okay,
Okay. Thank you. Thank you.
and there's the role play out of the way. Well done. How'd it go for you?
Oh my God. It's a nerve wracking.
Sure.
Honestly.
It's your first time doing it as well, right?
Yes.
So it's very, very new to the procedure as well. So tell me what you think you did well, and also anything you think you could have improved on as well.
Oh my God. I think uh for the first time for this first time, I
Mhm.
think I didn't do well. So if you could help me.
Well, Victor, it's always you always go to the things that you're not so sure of. But is there anything you think you did well as well? I want to do some positive reinforcement. What were your strengths? What do you think you're good at in your general English speaking as well as your OET role play practice today?
uh I think I don't know if can you please assess of what
Sure.
I'm good
Yep.
at,
I'll let you know what you're good at then. Okay, no problem.
or my weakness also.
Yep, of course, we're going to go through a bit of an assessment here for sure. Okay, so let's just go back to the role playing card here with the questions. So, first of all, did you speak clearly and was easy to understand? I think your pronunciation overall is quite good. Your intonation was also relevant. It's a strength, obviously. Your general English speaking skills were quite good. Question number 3. Oh, sorry, the questions aren't actually up. Sorry. There we go. Question number 3. Did the speaker speak fluently and smoothly with few hesitations and false starts? I don't think the issue was because of your language. There was obviously a good amount of stopping and starting and changing what you were saying. I think 1, it was to do with nerves, and 2, it was to do with organization. I just don't think you felt very organized for that role play. That takes time, by the way. The first time, it can be quite intimidating. How do I take these case notes? How do I organize this into a clear, coherent response? Also, I'm very nervous. When you're nervous, you're overthinking. What do I do? How do I structure this? So I think your organization and your nerves took away from your overall structure of the role play. Okay. Did you use an appropriate language and tone? Yep, for the most part, I think you did, minus a few inconsistencies with obviously your organization and your nerves. And did you use relevant and correct vocabulary and grammatical structures? Few small errors, but nothing overall. One thing that I did pick up on is that you said the bloods that has been lost. You said the bloods that has been lost. Can you correct that for me?
The blood that had been lost.
Yeah, so we can't say bloods. Yeah, so we talk about blood if we're collecting bloods of vials, but for me, it was about my blood, which we then wouldn't count. It's just the blood of one person, right? So it would be the blood that has been lost. So small errors there, but apart from that, not so bad. The one thing, of course, I want you to work on is your fluency and your smoothness of speech. But of course, that comes down to organization of the role play cards and just minimizing those nerves, being more confident in knowing what you have to do. Did you speak in a way that offered empathy and support? I did think there was a good amount of empathy throughout the role play, especially at the beginning. It did become a little bit less, but yeah, a good start for that. Did you listen to the patient and respond effectively and appropriately? For the most part, of course, once again, your organization and maybe your nerves took away from maybe responding to me effectively sometimes, but I do think that you did try to care for me overall. Was the delivery of information structured appropriately? This is the big part of your role play that needed the most work, I think. Okay. So think about your introduction. It kind of was all over the place a little bit. Think about how you ended the role play. You didn't really tell me what the next steps were. You just said, "Thank you very much for coming today. Bye-bye." Something like that. Okay. And think about the organization of your case notes as well. You kind of jumped around from the case note to the case note. The good thing about the case notes, Victor, is that they kind of flow from beginning to end. So the very first bullet point you'll mention first. The very last bullet point you'll mention last. You kind of mixed up bullet point 1 and bullet point 2. So organization is the one thing I want you to work on because that will improve everything. Of course, attending good OET classes, expert teachers, and getting feedback is the essential part for you to do that. So you know exactly what you have to do to organize your information. And was the patient satisfied with your delivery of information? I'd say for the most part, but maybe it might have been a bit confusing for a real patient to know what was going on in terms of the organization, what the next steps were, etc. Maybe were a few questions that might still have been answered. Okay, so work on your hesitation by improving your organization and
attend more classes.
Attend the classes, of course, that will definitely help. But a lot of things that are being done well today. But I do think, yep, if you were more comfortable with the OET role play structure and procedure, I think you would improve a good number of those things with your role play today. Okay. How was that?
Okay, thank you very much for all those informations.
You're very, very welcome, Victor. Thanks a lot for joining me today. Now it's over to you to make sure you put that feedback into place.
Okay.
And
I'll practice
more when you take it. Okay.
Okay. Thank you.
You're very welcome. Thank you. Have a good day. Thanks for joining me today, Victor.
Have a good day.
Bye. And that was Victor in our second role play today, guys. I hope you enjoyed the role play. Anyone, please throw me in any comments you have about Victor's role play today, what you thought he did well, and what you thought he could have improved on as well. Also reflect upon the feedback that I give Victor and our previous Dr. Midhat today in your own OET role plays. Is there anything that you would do that they did that you could improve on, or anything that you do that they did that you think that you do well as well? And that would be good for your OET role play overall. Okay, guys. Anyway, that is the end of our formal speaking class today. I just want to remind everyone before we finish today that, of course, we are currently running our free OET masterclass. This is essential for anyone who is looking to start their OET practice. They're like, okay, where do I start with my OET preparation? Well, why not with some free resources from a premium preparation provider school? You got access to 4 of our video classes presented by me on speaking, reading, writing, and listening, tips, tricks, methods, and the strategies you need to pass the OET the first time, as well as access to a free OET writing guide as well. The link will be in the comments, guys. Get signed up. Only use your email address. It is completely free, and learn how you can pass your OET exam first time with us at Swoosh English. Okay. Anyway, and next class day will be our OET reading class, guys. As you know, Swoosh English does a live class every Friday at 9 a.m. UK time. The next class will be going to OET reading. Last week we did essential skills for OET listening, part A. Next week we're doing OET reading essential skills for part A. So join the Swoosh English page or the OET official page Friday, 14th of May at 9 a.m. UK time. Come on over and join our essential skills reading class. We'd love to have you in that. So guys, you all want to know how to pass the first time. Questions for you. Do you have the motivation to succeed? I can see everyone here today wants to pass their OET exam for whatever reason you're taking the OET exam. Moving to your country of your dreams, meeting your family over there, working in your dream job. Do you have the time as well? Make sure you give yourself enough time to prepare adequately for the OET exam. So you might have those two things. Okay, I have plenty of time, I have the motivation, but do you have the tools in the form of great value resources, great value and also expert resources, and also support and feedback from people who know how to pass the OET exam and can tell you what you have to do to produce the exam as well. So do you have all of these? If you do, you're on the right track. If not, then you need to get some more support. And as I said, our free OET masterclass is one way for you to come on board and help yourself with your OET preparation with us at Swoosh English. Anyway, guys, thanks a lot for coming on board today for our free for the class. I hope you enjoyed looking at some of your comments. I'm very happy that you appreciated today's class. Of course, we do these mock speaking classes every 2 weeks, as well as a reading and listening class in between them as well. Thanks for joining. Thanks for all your comments, guys. I really, really appreciate it. You'll see at the bottom of the screen here that, of course, I didn't get a chance to answer everyone's questions today. But if you have any questions about the OET roleplay that you had, about anything about your OET practice whatsoever, then send our team an email. inquiries@swooshenglish.com. It's that way. It's kind of going that way. And you can check out our website at www.swooshenglish.com as well. We'd be very happy to help you guys with your OET preparation, whether it's queries or questions. And also, as I said, get signed up to the masterclass as well. So thanks a lot for joining today, everyone, guys. If you enjoyed the class, give me a like, give me a love, give me something that shows that you appreciate it. And I really appreciate all of your comments that I'm seeing today as well, guys. It makes me feel happy that you enjoyed the class. That means I'm doing my job right. Thank you very much, guys. Have a great day. Anyone who's taking the OET exam very soon, especially Sherry Rose, is taking the exam on Sunday. I wish you the best of luck with your preparation. I hope it goes really well for you. Thanks a lot, guys. Have a great day. Take care and